thank you for the introduction. First, I would like to introduce myself. I am a university teacher. I teach nurses and social workers, and at the same time I am a co-founder and head of patient organization in the Czech Republic. So I am on both sides of the problem. And I would like to tell you something about my work as a teacher. I teach at my faculty subjects with the name like holistic medicine or complex medicine or some patient-centered medicine. And because it is very difficult subject, I was nervous how I can examine students from such a demanding subject. And I decided to give them task to write a narrative about a story of patient. And when I started with these tasks, it was very interesting. I get many interesting stories, narratives. At this time, I have more than 1,000 of narratives. Every narrative is written by a different author. The authors are my students, and we have students of very different age, from 20 to 50, because we have the distance study. They are mostly women, I think you understand. And because I have had many of narratives, my soul of researcher was exciting that I should do something with the treasure, because I have treasure. So I decided to do with them something. First, what I did was give a title to the story, to the narrative. And I would like to show you how the titles look like. It was done without any intention to do research, only for recognizes the narrative. When I write down to the student index that they pass through the examination, to remember what story they write down. So very different titles. It was done without any intention for analyzing them later. But then I had 400 narratives. I decided to do something with them, and I tried to somehow categorize them. Again, without any intention, only what they tell the narratives. And here you can say my first names of categories, also without any system, only intuitive name of categories. Alternative medicine, willingness to make change, loss of life content, very different categories. Later, after some years, I asked for help, a philosopher, to help me with that, because I had already many of narratives. I was not able to determine what topics of narratives are the dominant. I wasn't able to put many of narratives to any category. And I was thinking about that in the striving for finding some analogies in the narratives. Maybe I underestimate the differences between the narratives. So it was quite difficult situation. So I asked for help. The philosopher, she is specialist in language philosophy. It's her topic of her head. She didn't read all the narratives. It is impossible to read more than 1,000 narratives. but she read some. And we had some questions then. Do we need for any narratives special category? If yes, is the title what I gave first to the category is the best category for the narratives? But the title is a big reduction of the content of the narratives. Maybe every narrative should be if in every category, but what is sense? Does it have any practical impact to give any narratives to every category? So we were discussing whether we do the good work to try to do something with the big amount of narratives. And our temporary findings is that they are very different, the narratives, but they have something in common. And we think that what is the common in the narratives is the trust or untrust, the relationship between the doctor and the patients. And we think what to do with them. We think that the trust is very complex term, complex concept, but we shouldn't to try to categorize them. It's the basic concept for us for the treating with narratives. We don't think that the trust is possible to somehow measure. We are very skeptic about that. So our conclusion is that the concept of good practice or patient-centered medicine has resisted to the attempts to find indicators. I was in the morning very skeptic, and today in the evening I am again very skeptic about possibility of measuring in patient-centered healthcare. I believe that some very complex categories and context and concepts are basic for this and are not measurable. And maybe our findings are best explained in this picture. We ended our trying to categorize. I use the narratives only as only in teaching of my students as a case study. We discuss the narratives, and I want to continue with this research.